Good morning, class. You want to know a funny story that happened to me at work over the weekend? I couldn't believe the patient gave me so much back talk over EHRs.
Did you get pudding thrown at you again?
Actually, no, I did not, but let's just say I had a very angry elderly patient.
Well, let's hear it then, doctor, since it's so funny, I guess.
Come on, team. Let's convince these elderly people to submit to EHRs. They technically paid for it.
Well, if you insist. Hopefully they throw their yesterday's pudding at you and not I.
Well, I'm off the clock for now. Jennifer, you will have to help Doc on this one. I'm too cool to talk to old people anyway. Good luck.
Well, let's get to work then.
Hello, Mr. Williams. I was told you didn't want your files updated to new system. And I'm here too.
Get out. I don't care about the stupid new system. I like it the way it is. You young people always try to change the way we do things around here. And I do not like it one bit messy.
But sir, we need to update your records.
And I said get out now. I want to see my doctor immediately.
If you insist.
Hello, Mr. Williams. I know that you are upset, but Jennifer is just doing her job. Now it is important that we embrace the new system and try to work together. Can you do that, sir?
No, I cannot do anything. You got your fancy degree and think you can come in here and tell me what I need to do. Then you got another thing coming, buddy.
Boy, did this escalate quickly. Not only are you a bit upset, but we will need to just better explain to you what an EHR is. Then maybe you would not be making a fool of yourself.
You've got some nerve, just like you all increased my copayment and got me spending hundreds on meds. You want me to just fall in line and accept this as well.
I understand that you are frustrated right now. Will you just be willing to watch a lecture I gave to my students on EHR? Then maybe that will stop all the confusion.
There will be no confusion this way. I like the old systems better, and you cannot convince me.
I'll have Jennifer pop you some popcorn as well if you like to watch with the...
Popcorn does sound nice right about now. But I think I got Jennifer upset. She might burn it, don't you think?
I'll make sure she does not do that, Mr. Williams. I could use a bag of popcorn right about now, too. I'll be back with your popcorn and we can get this show on the road. Mr. Williams. Do not fall out your chair now, Mr. Williams. I'll be right back.
Popcorn, 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 popcorn.
And what may that be?
Hey Jennifer, I think I got Mr. Williams to bulge butt under on circumstance. Can you pop him some popcorn?
Excuse me, you want me to pop popcorn when he belittled me and then dismissed? But he's lucky I am a nice nurse and I will pop it with care.
Mr. Williams,
Popcorn,
are you ready
popcorn,
to be
popcorn,
amazed by our
popcorn,
newly
popcorn.
updated systems? This is about to be a long day for me.
This popcorn tastes good. Happy Jennifer did not burn it.
Make yourself comfy, Mr. Williams. They'll be back to check up on you.
Good evening, class. I am Doctor for the record. Today's topic is EHRs.
Excuse me, Professor. What does EHRs stand for?
Basically, EHRs means electronic health records. This refers to an electronic version of a patient's medical history, maintained by a healthcare provider over time.
Can you give an example?
Say you go out and decide to buy drinks for everyone at the bar. You go to work the next day, and you start feeling sick to the stomach because of partying the night before. You go to the emergency room, feeling very nauseated, confused, lightheaded, and barely breathing. At this point, you feel like you are near death. Instead of staff having to go through many physical medical records, and getting frustrated from missing files, and waiting on your latest information, you now have the electronic health record that stores past and present medical records that can be accessed from an electronic device in a very short amount of time. The EHR system is constantly updated as you visit any medical physician or healthcare provider. This allows the physician that is currently treating you know your medical background, latest immunizations, medications you are on, and much more. With this information, they can quickly diagnose you, to provide you with adequate care, to get you back to feeling like yourself. They can then send your updated files to the pharmacist, allowing them instant access to further your treatment plan.
What is the difference between EHRs and EMRs?
An EMR tracks data, tell when patients are due for checkups, and helps physicians improve the quality of care given. EMRs have to be put into a computer, printed off, and then mailed off to specialists who are currently working with you. This could take up to a couple of hours or days. An EHR has the same principles, but is the total health of a patient. The information can be created, managed, and consulted by staff across multiple healthcare organizations. The EHR represents the ease of sharing and accessing medical information in a quick and secure way among the physicians and the patient, defining the term meaningful use. Now I have a question for all of you. If I get a correct answer from each of you, maybe I'll let you go early. Now, can you think of any benefits of the EHR system?
Some benefits could be: in an emergency, the EHR system could allow the emergency department to know of any life-threatening allergy, so they can adjust properly, if unconscious.
A patient could log on to their own record, allowing them to see any updates or changes over the year, motivating them to live a better lifestyle to improve their conditions. The lab results that were ran on during a patient's visit the week before could already be on record, allowing their physician to know what is going on, without running more tests.
Notes from a patient's hospital stay can have the instructions and follow-up care, making transitioning more smooth. This could also allow patients access in case they forget anything.
Great answers from all of you. You have just made me proud. But there is still more to learn in our next couple of minutes of class.
But I thought you were going to let us go early if our answers were correct.
I also said maybe. I think you all can handle a little more information. Then you can go out into the world and teach them what you learned today. What do you think?
No.
Okay. Just this time I will let you guys have your way. You have definitely earned it. Enjoy the rest of your day and I will see you guys tomorrow.
Thank God. We really appreciate you doing this. You just became my favorite professor on campus. This one is for the books. Okay, let's go before he changes his mind.